Hey, what's going on? Dr. John Blenio here. I am back. High Amplitude Health. I am excited to talk with you about my next subject. Last week, or the last video, I talked about what is the primary cause of lower back pain. We found out that the primary cause of lower back pain is muscles. The glute muscles, the hamstrings, and the thoracic muscles. Yes, those are the muscles that are the primary cause of lower back pain in 90% of the cases that I see in my office. And then the other question was, what can you do to make that back pain go away? And it's actually pretty easy if you know what to do. And that is foam roll. That's something that you can do at home, which is very helpful. And then the other thing you can do is, if your foam rolling's not necessarily working the way you'd like it, then go see a sports injury chiropractor like myself who does myofascial therapy. Myofascial therapy is really, really good for getting deep into those muscles to bring that tension down, bring that tone down, and to release those muscles so that you're not experiencing pain anymore. Before I go further, I just want to acknowledge from last week's video the people who responded and the people who commented on YouTube. It was really awesome. Marissa and Luke and Wendy and George and MR, all you guys responded, left comments, and you had some great comments, and everybody was on the right track. You talked about muscles, you talked about alignment, some people talked about core, a lot of different subjects. Everybody was pretty spot on, so that was really cool to see. But the people who mentioned the core led me to think about another subject. That's what we're going to talk about today. Core. There's something really, really important about the core that everybody needs to understand. The core needs to be activated. The core needs to be contracted to protect your low back. And a lot of people don't do that. They don't understand it. They don't even know how to do it. It's kind of a conscious effort, contracting the core in your day-to-day activities. That's where I want you to really embrace what I'm talking about right now, is contracting your core in day-to-day activities. That's what protects your back and keeps you from having frequent bouts of lower back pain. So, contracting the core. Here's the core right here. There's quite a few muscles to the core, but what I want to primarily talk about is the ones that you have control over on a day-to-day basis. And that's these muscles right in here. So let's talk about core activation. What is core activation? Core activation is simply the act of contracting your abdominal musculature. The core is incredibly important to use on a daily basis because it protects your lower back. A lot of people, they come in to see me and they say, I do crunches all the time. I do planks, I do lots of different core exercises, and they say, I have a strong core. Sure, you can have a strong core, but do you use your core? Do you actively contract your core when you need to? Let's just say you're going down to tie your shoes. Do you contract your core when you go into the lunging position? Are you consciously activating that core? If you're not, you should. If you're walking into, let's just say, Bank of America, and you grab that big metal door and you pull on that metal door, are you activating your core to protect your back, give yourself strength and stability to open that big heavy door? When you get up from a seated position to a standing position, when you go from a standing position to a seated position, getting in and out of your car, laying down and then standing up, or standing up and going to a laying position. All of these movements that you make throughout the day require you to use these muscles consciously as protection for your low back. Your core is an amazing stability set of muscles. It's the stability for your arms. It's the stability for your legs. Pitchers who throw the ball at 100 miles an hour, a lot of their rotation comes through their core, and they activate that core. Soccer players to kick a ball. Lots of different athletes, most athletes as a matter of fact, contract their core very well. And a lot of people think they know how to contract their core, but when I test them in my office and I stick my fingers into their muscles and I say, tighten those muscles, I'd say about 75% of the people either do it very weakly or don't know how to do it. So I'm going to describe to you, and I'm going to actually demonstrate myself and show you exactly how to contract your core so that you can protect your spine. And again, contracting your core on a daily basis is what protects your back, and a lot of people don't do that. So get ready. I'm going to demonstrate right now. There you go. Look at that. I'm going to show you right now how to contract your core. Here we go. I'm back. I want to show you how to use your core. Your core is primarily your abdominal muscles when it comes to activating your core and protecting your low back. So if you look at me right now, my core is relatively relaxed. Pressing into it right here. See that? Soft. Now I'm going to tighten it. So can you see? There's relaxed. There's tightened. I'm not sucking my belly button in. I'm not pushing it out, obviously, to tighten the core. It's right in place. Relaxed, tightened. Relaxed, tightened. So let's just say I'm going to lunge down to tie my shoe. I want to protect my low back when I do that. I do this all the time. Anybody who understands core activation, either from having played many sports or just kind of intuitively gets it, they know when to use this muscle. It's a conscious effort. So as I come down to tie my shoe, core is relaxed as I'm standing here, but now I'm going to probably tighten it about, 30, 40%. As I lunge down, that's tight. That's tight, maybe 30%. I'm coming down here, I'm tying my shoes, it's still tight right now, about 30%. Still tight. Now I'm going to lunge up. I weigh about 185 pounds, and going from a lunge position to a standing position, maybe I'll tighten it about 50% more. Now I'm relaxed as I'm standing. Let's do this again. I'm going to lunge down, tighten my core, take care of my shoe, tighten a little bit more as I come up, and then relax. The other thing would be if I were going from a seated position to a standing position, or a standing position to a seated position. So say I'm going to go sit right here. Core is relaxed. Tighten it about 30%. Relax. Now I'm going to go from a seated to a standing. Tighten it maybe 50%. Relax. The core is turned on and it's turned off. It's turned on and it's turned off. It starts off as a conscious effort. You have to actually think about it, especially if you have a little bit of acute back pain and when you bend over it kind of hurts. So you need to activate the core. Let me explain something to you. These muscles come all the way around and they attach to a gigantic tendon that's right here called your thoracolumbar fascia. And when you contract these cores like I'm doing right now, you cinch your lumbar spine and immobilize it to some degree, which protects your spine. If you're going to lift something, if you're going to squat something, say I'm going to bend over and there's my little Roomba right there, and I'm just going to go down and pick it up. The first thing you want to do is squat, not bend. So I would prefer you come over here and you bend down, tighten the core, lift it up, core's tight, and then relax, okay? Core's tight, and then relax. I prefer you don't do this type of thing. Bend over like this. That causes you to use these muscles a lot more aggressively. The core muscles are your strong power muscles. The lumbar spinal muscles, they're kind of like the marathon runner. They have a lot of endurance, they can last a long time, but they don't have a whole lot of power. If I were going to bend over without bending my knees very much, I tighten the core to protect this back. So if you do this, I'm bending way over here. This isn't the best way to do it, but my core is tight, like 50, 60, 70%. And then I relax when I come up to the top. So I'm going to bend down. It's tight, 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 and then back up and it's relaxed. Let me grab a golf club. if I grab this golf club right here and I do a golf swing, my core is definitely working. And this is tight right here. It's not floppy. I'm not keeping it all, ooh, look how I push my belly out. I'm kind of pushing it out. Here's actually how I hold my core. Let me deviate for a second here. I always keep about, I don't know, 10% contraction in my core. It's very subtle. I keep it slightly sucked in. I never just totally relax my core. Here's a totally relaxed core. You should never do this. That's, one, it doesn't even look good. But two, it projects your weight forward, which, I'm going to exaggerate here, creates more weight forward, which then has to make these, you have to make these lower back muscles work a little harder to hold you straight up. So always keep just a touch tension, 5%, 3%, 10%, somewhere in that range. But when you're going to bend over and you're going to lift something, or you're going to swing a golf club, you've got to tighten that more. So again, let me use this golf club example. I'm going to bring the core back, the club back, and then as I come through, my core is tight. That helps create stability for your lower legs, stability for your arms, and actually gives you more power when you use your core. Let's just say, I think I used the example of walking into a bank and I'm grabbing a big door at Chase or Bank of America, whatever. You know, those big giant metal doors when you walk into the bank, they weigh quite a bit. And one of the best ways to do it is tighten your core, grab and pull. Use your core. Tighten this. I'm just going to show you my abdominal musculature. Here is a relatively relaxed core. Here is a tightened core. A relaxed core, a tightened core. It tightens in place. It's not this, it's not that, it's that. Relaxed core, watch my fingers. Relaxed core, tightened core. Relaxed core, tightened core. So this is what I want you to do on a daily basis. I'm going to lay on the floor. I'm going to go to a laying position from the standing position. I want to protect my lower back. So it's tight right now. It's tight, it's tight, it's tight, it's tight. Now it's relaxed. Now I'm going to go up to a standing position. Tighten it, tighten it, tighten it, relax. So what I really want you to understand is you have to get used to turning on your core, turning off your core in all of these daily activities. You're picking up your child, tighten this, right? You're tossing your child up in the air, or you bring them up to here. These muscles have to be tight. Your child weighs what? 30, 40 pounds? That weight wants to pull you forward. If you're not using these muscles, all of these muscles are getting overworked, and they could get strained, and they could become very, very painful very fast. I hope this little bit of demonstration helps, but I think you get what I'm saying. Follow my lead on this. Understand what I'm saying and do it, and you will rarely have back pain. I'm 54 years old. I never have back pain, or rarely have any kind of back pain. And I attribute that mostly to the fact that I use these muscles when I'm supposed to. I relax them when I'm supposed to. Like right now, they're relatively relaxed. But if I'm going to lunge down to tie my shoes, I'm tightening these. I'm protecting my back. It's a conscious effort, but do it. Thanks. Let's rehash here. Core activation, core contraction is extremely important on a daily basis. Activities of daily living, this muscle should be used often. What did we say? Bending over, tying your shoes, lunging down, lifting up your child, throwing a ball, opening a heavy door, squatting down to pick something up that's heavy. You've got to activate these muscles. Also understand that activation of these muscles is relative to what you're doing. So if it's just going down to tie your shoes, maybe you contract it 30%. If you're lifting up your child who weighs 40 or 50 or 60 pounds, maybe you have to contract it 50, 60%. You change how much you contract your core relative to how much effort you're exerting to lift or bend or lunge. And just remember, core activation protects your spine. Your abdominal muscles go all the way around to your spine and immobilize your spine and cinch it tight. And they give support to your low back. So anytime you're bending and you're lifting, if you're bending, your low back needs to be supported by these muscles. Make it one big unit, one contracted unit to enable you to be more stable and lift heavier objects. And just remember, the core is the stability for your arms and your legs. The core is the foundation for your entire body. Thanks for listening. Dr. John, High Amplitude Health. Glad I could give you some information about how to take care of your lower back by using your core. Please comment if you have any thoughts. Please like this video and please subscribe to my YouTube channel. Thank you very much. Have a great day.